Cerebral edema, swelling of the brain tissue, may be local phenomenon almost any lesion, be it contusion, laceration, tumor, or in fact, but here we are more concerned with the generalized edema. Swelling of the brain is extremely common after a substantial head injury, especially in children. Though it is an almost inevitable accompaniment of almost all intracranial hemorrhage, such as damage as either a local or general phenomenon. It can occur as the sole abnormality, not infrequently prove fatal, particularly in younger victims. It is the most common cause of a raised intracranial pressure, being seen more often than localized space occupying lesions such as hematomas and tumor. Though of course this often coexists with the cerebral edema. Uncontrollable swelling and the subsequent rise in intracranial pressure is the single most frequent cause of death after severe traumatic brain injury. Edema may be vasogenic, hydrostatic, cytotoxic, osmotic, or hydrophilic. Vasogenic edema, the permeability of the blood-brain barrier increases as a result of an injury to the vasculature due to tumor, trauma, infection, intracranial, intracerebral hemorrhage, or infarction. Edema fluid is primarily in the extracellular space and tended to occur in the white matter. In hydrostatic edema, the blood-brain barrier fails because of increased blood pressure, as in a hypertensive encephalopathy or in an epileptic seizure. The excess water is mainly extracellular both in grey matter and white matter. Cytotoxic edema results from disturbance of the energy-dependent transmembrane ionic pump, most commonly due to ischemia as a result of vascular occlusion or other causes such as traumatic brain injury, metabolic disorders, or certain intoxicants. This leads to an intracellular accumulation of fluid mainly in the grey matter due to its high metabolic activity and greater astrocyte density. Osmotic edema results from a hypoosmolality of blood plasma in a condition where the blood-brain barrier is intact, but the blood becomes too diluted because of freshwater drowning, water intoxication, or excessive administration of intravenous fluid, or the syndrome of inappropriate antidiuretic hormones hypersecretions. Hydrocephalic or interstitial edema is caused by leakage of pressurized CF through the ependyma into periventricular brain tissue because of obstruction within the ventricular system, or the obstruction is distal to the ventricle. Decreased transfer of CSF into the subarachnoid space, impaired flow of CSF in constricted subarachnoid space, or hindered reabsorption of CSF via arachnoid granulation into venous matter. Autopsy features of cerebral edema are readily recognized on removing the calvarium. The dura is stretched and tense, the brain bulging through the first incision in the membrane. The gyri are pale and flattened and the sulci filled, giving the normally corrugated cerebral surface a smoothness that can be easily felt at autopsy. The cut surface is pale and especially in children, the ventricles may be reduced to slit by the swelling of the adjacent white matter. Severe cerebral edema causes the larger volume cerebral hemisphere to press down the tendorium and herniate through the tendorial opening. The hippocampal gyrus may impact in the opening. Lesser degree causes grooving of the hippocampal ancae. Both this effect may lead to hemorrhage and necrosis at the site of pressure, especially where the sharp edge of the tendorium cut into the cerebral tissue. The tonsil of the cerebellum may be impacted or coned into the foramen magnum, sometimes forced down into the upper part of the subspinal canal. The pathologist must be careful not to mistake the normal anatomy grooving that often exists around the cerebellar tonsil for coning. There should be other signs of brain swelling, and a true tonsillar herniation will show discoloration or even necrosis of the ischemic tract tissue. Normal and edematous. Normal weight is less than 1500 gram, increased weight more than 1500 gram. Palpable sulci, flattened gyri, rounded gyri, filled sulci. Normal hippocampal gyrus and angus, grooved angle, swollen hippocampal gyrus. Normal cerebellar tonsil, herniated cerebellar tonsil, midline shift to edema is unilateral. Cerebral edema may be the only intracranial abnormality found at autopsy after a substantial head injury has occurred. This seems to be more commonly found in children and in the absence of any other demonstrable lesion. The cause of death has to be attributed to the swelling in the brain compressing the vital structure in the brainstem. Obviously, many other causes of cerebral edema resolve either spontaneously or with the treatment. So, So that fortunately no opportunity arose to prove its existence by postmortem examination. Such edema is however not frequently found during surgical exploration of a meningeal hemorrhage, the latter sometimes being presented through often only brain swelling is demonstrated. Cerebral edema may be self-potentiating in that once it begins as a result of direct brain trauma, the consequent rise in intracranial pressure then impairs the venous return from intracranial sinuses. The pressure is sufficient to restrict the arterial inflows of further congestion and swelling occur. This may lead to worsening of the cerebral hypoxia and edema to the stage of acute cerebral infarction and death, brain death. Again, a distressing common syndrome seen especially in the children victims of the head injury, usually from road traffic accident. Cerebral edema, either traumatic or hypoxic, can develop with a surprising rapidity, especially in children. Macroscopic evidence of brain swelling can be seen at autopsy in cases where the interval between trauma or onset of hypoxia and death was less than 1 hour. Several methods are available to reverse edema, including hyperventilation, which acts by providing full oxygenation, reducing the peripheral carbon dioxide tension, thus causing constriction of arteriole, resulting in a reduction of the amount of intracranial blood and therefore also the brain volume and transudation. Thank you.